Rita Tinina, KTN News.
Tonight we are reporting on the worrying COVID-19 numbers, and today the country has recorded more grim statistics with another high number of deaths arising from COVID-19 related complications. Over the last 24 hours, 25 deaths have been recorded, with the number of new infections standing now at 1,127, reflecting a positivity rate of 22.1%. The country's healthcare system being stretched to the limit, with most ICU beds countrywide full to capacity. Let's get more from KTN's Chebet Birir.
The third wave of the COVID-19 pandemic is proving hard to stem in Kenya, as it records a 22.1% positivity rate. The Ministry of Health has today reported 1,127 more positive cases out of a sample size of 5,393. This raises the country's caseload to 123,167. In terms of patients occupying ICU beds, the ministry says 135 patients are in ICU, out of whom 34 are on ventilator support. 98 of these are on supplemental oxygen, while 8 are under observation. Fortunately, 210 people have recovered from the disease, 110 coming from home-based care, while 100 of them are coming from healthcare facilities. But more worrying is the number of deaths, which over the last 24 hours stood at 25.
Our services in our health facilities are stretched out, but may I say, not quite overrun. All our medical teams and health facilities have been advised to be on high alert and care for our people who need any medical attention.
The Ministry of Health has also warned that there are no spaces left within intensive care units across the country, as patients are on a waiting list. The ministry is, however, concerned over the manner in which private hospitals are overcharging patients. The matter, according to Health CAS Dr. Rashid Aman, is being investigated by the medical board.
We're seeing that the public is no longer concerned, and this will overwhelm our healthcare system. In fact, this has been evidenced by the reports and the current situation of lack of adequate ICU units, and more importantly, the lack of adequate critical care specialists. So even as you're talking about expanding and building ICU spaces or increasing the ICU capacity, there is no adequate personnel, doctors, nurses, who work in critical care units.
That private hospitals are demanding huge sums of money from ailing Kenyans in need of critical care before they can admit them to their ICU and HDU facilities. This is not only unethical and callous, but unacceptable. I wish to remind our healthcare providers, both private and public, that we are in a pandemic. And this being the case, it is not the time to punish our people through some self-seeking, money-minting, opportunistic escapades.
And in a bid to cope with the pandemic, the Kenyatta National Hospital has also scaled down on its operations. In a notice released by the hospital, all elective surgical procedures have been put on hold, while all stable patients should be discharged. All outpatient clinics will also be scaled down and are to be rescheduled or referred to the nearest level 4 and 5 facilities. This came on a day that 2 prominent Kenyans who died from COVID-19 were laid to rest. Kericho Deputy Governor Susan Kikwai was buried at her father's home in Tugunon Village, Kericho County. Top local leaders, including Governor Professor Paul Chepkwony, attended the ceremony. And in Nairobi, media personality Lona Irungu, who died of COVID-19, was cremated. Chebet Birir, KTN News.
In a related turn of events, tonight the Pharmacy and Poisons Board has given emergency approval